Everyone, I'm Candy Waller and I'm with the Gardening Talks Committee. Tonight's presentation is entitled Gardening Ergonomics with Dr. Natalie Foray is the presentation. The presentation itself will be about 50 minutes long and there'll be 10 minutes at the end for questions. Please mute your speaker and take yourself off video to prevent distractions. The chat box at the bottom will be open for questions to Dr. Foray. We'll collate the questions and send them to her to answer or ask them at the end. If you have ideas to share with other participants, please save those for some other format. Before you leave the presentation tonight, we would very much like it if you would complete the short survey. The survey will be available as soon as we begin the question and answer section. You'll find the poll just to the right of the chat box at the bottom of the screen. Okay, we ready? Dr. Foray. This evening's presenter is Dr. Natalie Foray. She joined the Innovative Therapy and Wellness team in 2014. And she uses her expertise in orthopedic manual therapy to achieve the highest level of functional outcome for her patients. She specializes in treating patients that have back and hip pain and have a passion for helping women live a full and healthy life. As a former athlete and certified yoga instructor, she enjoys working with patients to help them reach their full movement potential, plus improving their quality of life. She has a BS in education and with a major in kinesiology from UVA. She has a doctorate in physical therapy from the University of St. Augustine, and she is a certified myofascial trigger point, and she is a therapist, and she has a manual therapy certification. Dr. Foray, it's pass it on to you.
Okay, thank you, Candy. Hi, everyone. Thank you so much for having me tonight. I'm excited to share this information with you. So this talk is about gardening ergonomics, and I'm hoping to just kind of present a little bit of a different viewpoint, maybe have you consider some things that you haven't considered before with your own ergonomics. So the objectives for this evening, we're going to do an anatomy overview, just to share what the main muscle groups that you should be using during gardening are. Some core engagement strategies to help support the spine more efficiently. Techniques and tips during specific gardening activities, through digging, weeding, carrying, tool use, and a few other gardening activities. The use of braces and supports, and then some exercise guidelines for stretching and strengthening. And then, like Candy said, there'll be some time for questions at the end. So let's jump right in. The anatomy overview. So generally speaking, we want to try and use our larger muscle groups as much as possible when we're doing anything that requires a lifting, a bending, or any kind of a repetitive motion. Okay, so specifically what I'm thinking about is if we're bending down, getting back up, carrying things. So we want to be using more of the glutes, the hamstrings, and the quads to support our core. So the core is going to be kind of all the way around, and we'll get into the core a little bit more in a few slides. But the glutes, you can see, are in the back here. You also have your glute med, which is on the side, and we'll get into that a little bit with your strengthening. Your hamstring muscle groups go down the back of the leg, the upper part of your thigh. Your quads are in the front of your leg. You have 4 of them, hence quad. So they're in the front part of your leg. And then, of course, you have your shoulder muscle group. And the reason that I want to draw a little bit of attention to that is because your muscles in your shoulder girdle are a lot bigger than the muscles that are in the rest of your arm. So when you're doing activities such as pruning or weeding, we want to think about, okay, what muscles are we really using there? If just the muscles in your forearm, wrist, and hand are working, it's going to be a lot harder and they're going to fatigue a little bit quicker and potentially cause an injury. If we can get a little bit more of this proximal muscle group, you can see that these are larger muscles involved, meaning your shoulder is doing a little bit more of the work, and that's supported by your core, then you're not as likely to have an injury lower down in this area. Same thing for the lower legs. We want to use these big muscle groups so that we're not using the smaller muscles right around your spine, potentially causing an injury. So, what does this mean for you? When you do something like a squat, you can see that these are the main muscles that should be working, right? So, notice which muscles are not working. These right here. And this is what I see the most common thing all day in my practice, people who have pain right in this area here, okay? So we're gonna talk a lot about that tonight, about how to prevent some pain in that area so that when we are squatting down, when we're bending, when we're doing our gardening activities that we love, how do we use these muscle groups and these muscle groups instead of using this right here, okay? So what is your core? Just to zoom in, highlight this a little bit more. It's all the way around. It's not just your abdominals in the front. It's also your obliques on the side. It's also your glutes. And it's everything that supports, this is all the fascia that supports your core all the way around your body. So it's not just something, oh, I do crunches, which by the way, I don't love crunches, but I do crunches to engage my abdominals, therefore my core is strong. We really need to think about the core as encompassing everything all the way around. So how do we better engage our core to help you? Talking about the abdominals, talking about the front part. You want to do breath. Make sure that you're breathing. And ideally, we're exhaling during the harder part of any type of, I say exercise, but activity. Maybe it's while you're getting up from being on the ground. Maybe it's while you're carrying something. Maybe it's while you're getting a bag of mulch or a plant or a flower out of your car. You want to exhale while you're doing that initial lifting motion. The reason for that is physiologically, even if you don't even mean to, when you inhale, the belly fills. There's intra-abdominal pressure that increases. When you exhale, the belly button pulls into the spine, and that automatically gives more support to your spine. Therefore, we're just using what's already happening to create a little bit of better environment to support ourselves. So we're exhaling during the harder part of the exercise. Also, we're creating an internal brace, an abdominal brace. This abdominal brace, you're going to pull your belly button to the spine, and that's just feeling your abdominals pull in. So if you have a current injury, or maybe you're dealing with something like a chronic injury, you may also consider an external spinal brace, and we'll talk a little bit more about braces in a little bit. You want to maintain a neutral spine. And so positioning and alignment is really important for how to engage your core to help. I'm going to talk a lot more about that. So what is a neutral spine position? So posture has a lot to do with it. But think about it this way. Posture is not static. A lot of people think, oh, I need to keep this really like stiff, upright posture. But we move, and we should be moving throughout the day. So posture is really your control and keeping that good alignment while you're moving. It's not just being still and holding that good posture. So a neutral spine is more the term used for the position of the spine where all three of the curves are in the proper alignment with each other, whether you're moving, whether you're sitting, whether you're doing an activity. So you can see the three parts of the spine are your cervical, your neck, your thoracic, which is your mid-back, where your ribs are also attached, and your lumbar spine, which is your lower back, okay? So the cervical, you should have a little bit of a lordosis or an extensive curve, where the thoracic, it rounds out a little bit more. And then you have back to that lordosis in the lumbar spine. Okay. That's why you might have seen like a lumbar pillow. It kind of fills that space right there because you should have a little bit of a space there with this slight anterior tilt of your pelvis. So this neutral position is the most comfortable and most stable position for the spine to be in while you're doing an activity. So you should aim to keep your spine neutral as you do all of your activities, okay? So this is kind of the goal. And we'll talk about more what that means when we're doing something like a squat or a movement in the garden. So we want to try and make sure we're not rounding too much in your thoracic spine and also not rounding too much in your lumbar spine here. That's really important. And then just notice the position of the other joints in your body in a neutral spine, right? So if you have too much rounding here, your knees are kind of bent and everything's not lined up, your shoulders might be more forward. And when you have a forward shoulder position, you put more stress on your rotator cuff, on your shoulder muscles. Then when you go to be working or using those muscle groups, they're not in an ideal position. Remember that it's the most comfortable, stable position while performing any activity. So let's get back to your back for a minute, because that's, again, is probably the most common injury that I see. That in order to protect your back, ideally, it's important to know how you're going to hurt it, right? What do we avoid to in order to protect your back? We want to avoid the combination of bending, lifting, and twisting. The bending, lifting, and twisting, especially combined with all of those at one time, sets you up for a lumbar disc injury. Okay, so we want to keep that nice neutral alignment so that we're not putting more pressure on the disc. This disc lives in between the vertebra. All the vertebrae stack nicely on top of each other, and the discs are like a jelly that goes in between them. So if you have too much of a bend, say you're bending forward, you're facing me, bending forward, and then you are twisting, and then you go to add a load and lift, that disc potentially could herniate or just get really irritated and go kind of in the opposite direction. So especially if you don't have proper strength and then a knowledge of how to move, you're going to increase that risk of the injury. It's not to say, okay, never do that motion, because in life we move through different ranges, but making sure that when you are adding a load to it, you're moving correctly. And then when you're giving yourself a little bit of that support, that strength, remember the abdominal brace, your breath, that gives you the extra support that you might need, okay? So what does a proper lift look like? Here is an example of how we want to plan our proper lift. So we plan it. And what that means is we get close to the object, okay? A lot of times we want to pick something up, but it might be in an awkward position, or we're just like, oh, we can just reach over. Get as close to it as possible so that that spine can stay nice and neutral. If it's something heavier, you might ask for help. There's nothing wrong with that. You want to widen your base of support. That allows you to get lower and use your hips. I have some other demonstrations of that. Now bend your knees and feel those abdominal muscles tighten. You want to use that support that you can give yourself around your spine. And then you're going to lift with your leg muscles. Remember that first slide? You want to lift with these muscles, your glutes, your hamstrings, your quads, not these muscles right here. And what should be in here too is exhale, right, as you come up. You want to carry something by keeping that load nice and close to you. And when you go to put something down, you want to still keep that nice neutral spine, that good support, all the same mechanics, keeping that wider base of support and putting it down right in front of you. So this is kind of a general guideline of some things to think about when you're doing that good lift. And something that I consider is you should be lifting a pencil that you dropped on the floor the same way as you're lifting a 10-pound or a 20 or a 30-pound weight. You still have these same mechanics that happen to support your body. And the more you can get into that habit, you might say, oh, I'm hardly ever lifting anything heavy. But if you are lifting something light the wrong way over time, that might just be the straw that broke the camel's back, right? You want to make sure that you're practicing these good habits and make sure that you're incorporating that into your daily routine so you don't set yourself up for an injury. So, talking about some other repetitive use injuries. Let's talk about the shoulders for a minute. We talked about how the bigger muscle groups, more at the shoulder girdle, should be used instead of just the forearm, wrist, hand muscle groups. So what might be a type of shoulder injury? The most common thing is a rotator cuff injury. So if you have 4 muscles that make up your rotator cuff. And so that is a muscle group that helps with that stability of your shoulder joint. So the type of injury that we see with that most commonly is a tendinitis, which is an inflammation of those tendons around the joint, or an actual tear. And the tear can be varying degrees. It might be a micro tear or it might be a complete rupture. Micro tears are more common. So an inflammation or a tear in the tissues connecting muscle to the bone, that's what the tendons are around the shoulder joint. That would be a tendinitis, the inflammation. It often occurs in people who repeatedly perform the same shoulder motions. If you're doing something over and over and over, and that's specifically with the presence of poor mechanics. So if you have a more rounded shoulder because your spine is more here, and then you go to use it over and over, you're not going to have the same mechanics going on at the tissue level if you are upright and had a nice free shoulder. Okay, so symptoms will include shoulder pain and weakness, and then you can see that the treatment is usually rest, medication, physical therapy, possibly an injection, and possibly surgery depending on the nature of the tear. Surgery is usually with a tear, and you would want to see your doctor. The other joint that is involved typically, I tried to kind of pick some things that were more relevant to your population in the wrist. So most people have heard of carpal tunnel syndrome. That is generally this area of the wrist and hand. Right in here is your carpal tunnel. And that's the median nerve that comes right through here. And that median nerve innervates primarily your thumb and some of your third finger. So you have this numbness and tingling in the hand, and it's caused, some of the things that contribute to it are just your anatomy. Some people have smaller space in there, some underlying health conditions. If you have perpetual swelling, that can contribute. You have pain in the hand and arm, numbness and tingling, and then you would use ice. You want to rest it, potentially use a splint, which would keep your hand in a position where you wouldn't have that load on it. So you would basically take the load off of that ligament, and possibly an injection and surgery in severe cases. That's generally more seen with like typing type injuries, but it could potentially happen with a gardening use. De Quervain's tenosynovitis might be a little bit more common, and that would be more on the side of your hand at the thumb. You can see right here, we have some swelling of these tendons caused by repetitive motion. And if you look at that hand, that's kind of the same motion that you would use for like pruning or cutting or something repetitive like this, perhaps in the garden. So repetitive hand or wrist movements can make the condition worse. You would have pain and tenderness in the wrist, often right below the base of the thumb in this little space right here, called the snuff box space. And then treatment may include medication, physical therapy. Usually it's not a surgical treatment, it's just an inflammation. So we want to try and calm that down. Also ice, and in rare cases, surgery. We still doing okay? And then let's talk a little bit about some gardening specific mechanics. So we have digging is first. So this picture obviously is for digging with a larger shovel, and a smaller shovel or more close to the ground techniques will be discussed soon. So with digging, it's similar to lifting. Remember those lifting mechanics that we want to get close to what we're working with. So we're not leaning and bending forward. So you want to stand close to the shovel. You want to keep the abdominals engaged. If you do have that slight bend in your knees, you shift the weight back slightly into the hips, which remember you want to use your glutes and your leg muscles, not your back. And so the leg muscles is going to be what's used primarily to push the shovel into the ground. And you want to be mindful of your wrist position here, making sure that they're in a neutral position. What I mean by that is that you're not holding the shovel extended back. You're not flexing too much. You're pushing it down from a neutral wrist, maybe in this position here, or even getting on top of it like that. And you want to straighten your legs when you lift the dirt up instead of leaning over and then coming back up. So those are, again, for a bigger shovel use. So this is for pruning. You might recognize my wonderful model here. Kathleen Fitzpatrick was happy to help me here take some pictures of some common things that she does in her garden. So what I want to demonstrate here is I want to preface this by saying I love Kathleen Fitzpatrick dearly. I have known her since I was about 4 years old. And I asked her to just show me how you would do something in your garden. And it was really helpful for me to kind of see how would somebody who does do this a lot just go about trying to do the proper technique that they're trying to achieve. And then we kind of talked about, okay, how might we do it differently? How might we take a little bit of stress off those joints? How might we modify that some so that you can continue to do this for a much longer time? So you can see when she goes to prune something like these hedges, she wants to just lean over. And that puts a lot of stress on the back here, on the low back. So what I suggested to her was, let's bring your feet wider, and then you can sit down into your hips. Remember those hip muscles, the glutes, the hamstrings, the quads, and they can take a lot of the load off of your back. And then it's kind of like a horse riding stance, right? If you're on a horse, you get those bigger muscle groups involved and they're doing the work versus all in your back. And then look at what's happening with her wrist here. So her wrist is being angled. I have some pictures I'll show you a little bit more. And then if she changes her and uses more of her shoulder to do the work here, then the wrist automatically ends up in a better position and a better alignment. So just starting to pay attention. How am I getting down? How am I doing those things? Can I maybe bring my feet wider? Can I sit back into my hips? Can I engage my core? Can I breathe? What's my shoulder doing? And the more you think about this, the more natural it becomes to just start to do it that way. And you don't have to think so hard about it every time. So this is an example for raking. So raking is similar to the digging techniques here, where you want to get close to your body. So notice how when he's trying to rake all the way out here, he has to lean forward versus bringing it upright and close to your body. And this seems silly, but a lot of times people don't want to move their feet. Like you think about it, I don't know how many people watch sports or play sports. If you are playing sports and you're static, it's a lot harder to use your body to move and catch the ball or go where you need to go. If you kind of stay light on your feet and get ready to move quickly or be willing to step, it can make all the difference in the world at how your body absorbs that force. So don't be afraid to take that extra step or move your feet to get a little bit closer to what you're working on and take that extra 2 seconds to make that change. You want to stand up straight. You want to avoid the bending forward while twisting, especially. Remember that bending, lifting, twisting, the BLTs we want to avoid. Bending, lifting, twisting equal lumbar disc injury. We'll keep the abdominals engaged and then switch sides with the rake. So raking is not one of those things that you should need to have a really dominant like force position. So you should be able to switch sides, and that just keeps things a little bit more even, uses both sides of your body, takes some stress off of your shoulders, and just makes you a little bit more even and aware throughout that position or activity. So weeding. So depending on how you weed, you might need to play with changing positions, especially if you're having pain. And there might be a position that works best for you, and then you might find that that works all the time. So here's some suggestions that I have. If you have back pain, a half kneeling position or an all fours position might be better to avoid leaning over. If you angle yourself to your weeds, meaning you're not facing them head on and leaning forward to get them, you're turned slightly, and then you can go straight down to weed them out. That takes a little bit of a pressure off of your spine. Instead of the bending forward, you're just reaching down. You want to stay low to the ground, again, so you're not reaching. Use your hip muscles to squat down and get up, and remember your core. You might start thinking, she's saying the same things over and over for each specific activity. And in some cases, you're right, because these are the main points that I want you to take away from this and say, okay, Natalie said, engage your core, breathe, use your hip muscles, use your glutes, squat down, don't use your back, bend your knees, get a wide stance. I want you to remember this, and it is very applicable to all of these things. If you have knee pain, you might use a small stool to take the stress off of your knees. You might use a wider base of support, meaning bringing your feet wider. Take some stress off of your knees. You have to bend them less the wider you go. And then use assistance to get up. I know that I've seen gardening stools where they have like the handle on them, and you can kind of pull up on that, and that can take some pressure off of your knees as well, so you're not kneeling on them. If you have one knee that doesn't feel great to kneel on, that half kneel position might be great for you. Also, while you're weeding, you want to be mindful of your neck position. Remember that posture diagram where your neck, you want to make sure you're not all the way forward with it. Some people get really into whatever they're doing, and before you know it, their neck is like all the way out here. You want to make sure that it's staying in line with the rest of your spine. Use a kneeling pad to cushion yourself, and then take breaks as needed. And use the tools as much as possible to take some stress off of the rest of your body. So here are some more demonstrations. So again, with weeding, the bending part of it, again, bending down, we have this rounded spine here. So we could have gone a little bit wider like we did in the pruning picture. I already showed you that. So here are some other options. Put one knee forward. Now we can lean that elbow onto that knee, which helps us to get lower to the ground, right? And then see how her spine really flattens out a little bit, and she has less curving throughout her whole spine. She can get into her glutes, use her legs a little bit more. Or squatting down. She's in a position where she can squat down, and see how nice and neutral that keeps your spine when you do squat. And then of course the legs are doing the most of the work, and she can be right down on the ground. She also has her kneeling pad if she needs it. If you are weeding at the ground level, there's a lot of options. You can be on all fours, like we talked about, and you can cover a lot of ground with that. You can be in a half kneel position where you're right here. You can't see her other knee, but it's right here, and her foot's right there. And then you're able to reach straight down there. You can be in a half kneel, leaning out and reaching out. What is not so ideal is, again, being really far away from the area that you're working on. So you want to try, and generally, if you start here and you're like, but I want to get this weed all the way out here, either A, move your kneeling pad so you can work out there. Stand up and go back to one of these techniques. Or you might even bring a foot up, so you are in a little bit more of that extended lunge, and that's actually a safer position than just reaching out with your whole body. So those are some considerations for weeding. Carrying. So carrying is the same considerations as far as lifting. You want to carry things as close to you as possible, and that'll help you avoid injury by keeping your center of gravity close. So you keep it in front of you, ideally, or you might do a farmer's carry where your elbows are down by your side. I'll show you a picture of that. And then also with carrying, you want to make sure how you put the object down. You want to bend the knees. Remember, when we put something down, put it down right in front of you, bend your knees, the same concepts. So with carrying something, and this is just a grocery bag, but it might be a bag of mulch, it might be a hose, it might be a watering can, it could be a lot of things. So we want to make sure that that spine is nice and aligned, and that neck is in line with the spine. The shoulders are in a better position, your core is engaged. This says to take a punch. Some other ways to think about that are, if someone's gonna punch you in the stomach, you wanna pull in. I usually cue people with things like you're putting on a pair of tight pants and you gotta really pull in to suck them in, or you're about to sit up to get out of bed and you gotta pull in to engage your core there without the rounding motion. And then your shoulder blades are down and back, and your tailbone is not necessarily tucked. I don't love that word. You're not rounding, tucking it under, but as opposed to this where you're kind of sticking your hips out behind you, it's more in alignment. And this, you can see how far his head is forward and rounded shoulder. You might look at this and say, that would be ridiculous to carry something that way. But trust me, when something's heavy and you're just trying to get it from here to there, you might not really realize how you're carrying it. And so just having that little bit of awareness, stand up tall, because it is actually easier. Remember, in a neutral spine position, your muscles are in a position to work better for you. And when they can work better for you, they give you more strength, they give you more support. This is a side view, which I like too. A lot of times people will carry something and they kind of lean away from it and they don't even really realize it. So imagine you're doing that for, I don't know, maybe you're working for 5 days straight in your garden, trying to get new mulch laid or trying to get something accomplished there, moving rocks or something like that. And you're doing this for 5 days. Can you imagine how tight that might feel, or how that might make your back feel? So we want to really make sure, even with that, we're using that good form, that upright trunk. Okay. Just a side note too, with your purse, if you have a purse that you always carry on your shoulder, be aware of that too. Are you side bending to keep that purse up there? So here's some tool use and considerations. So with tools, try to focus on kind of smaller motions that might affect your wrist a little bit more. You want to keep that neutral wrist position while you're holding the tool. And what I mean by that is this position right here. So see how the forearm and the hand are just naturally in line and you don't, quote unquote, break at your wrist? This is a poor position. This is where you're breaking at that wrist. And you're putting a lot of stress on those tendons here. And remember that de Quervain syndrome, where you have right along here, that inflammation of the tendon can be from this poor position. You want to keep a neutral wrist, which means that you might be moving your whole body. You might, if you need to get lower to move your shoulder down, or maybe get higher to move your shoulder so that your wrist isn't doing this. Also, let the tool do the work. There's a few examples for that. The longer lever arm makes it easier. So if you're trying to break a thick branch or a twig, and you're trying to use something, or say you're trying to dig up something, I've had this experience, You're trying to use a smaller shovel, right? And you're like, oh, this is really hard. I'm going at it with the shovel because I'm already here and this is what I have in my hand and I don't want to walk to the shed to get the big one. Well, it's going to take you a lot longer and you're going to put your body at more risk for injury than just going to get the longer lever arm to get more force to dig up that area. Also, with that said about the tools, you want to make sure that your tools are sharp and that they're the right tool for the job. So a sharper tool is going to put less force on you because you're not going to have to do it as much. You're going to have to just a quick cut might be all you need. Remember your body mechanics, and then it's important to use them correctly. So here are some more pictures, some more examples. Here's pruning. These are a little bit closer pictures. I pointed out Kathleen's wrist earlier. And so you can see that in this position, her wrist is breaking, okay? And so then once we said, hey, get down a little bit, let's change that position. You can see her wrist is nice and neutral to go for that same general area. And it might be that she's getting something lower. She can keep that forearm and wrist in alignment. And those are all really good to prevent injury. So with digging, again, I had her kind of show me, I didn't cue her really much at all for the first time I took her pictures. I just said, show me how you do this. And so the first time she rested her forearm and she started to dig. And you can see that that's all wrist motion here. So her forearm's resting, which means nothing in her shoulder or upper arm is helping, and it's all coming from right in this area. So when we said, can you lift your elbow up off of your leg and then get your whole shoulder involved, her wrist position might still not be great in this, but at least she's using more muscles than just her wrist. Now her upper arm can help. And she even told me at the time she could feel a difference in it because she's not just doing this. She's kind of getting her whole body behind it, which is really helpful. And then do some research on what the best tool is for you. People have different things going on in their bodies. They might feel like their wrists are great, but their knees not, or maybe they can't hold something overhead if they're trying to use a power tool. Maybe there's something out there that you don't even know about yet. There's certainly a lot of things on the market, and there's more stuff coming out all the time. I just did a quick search and there's this tool, there's this shovel or spade that has a handle that goes this way. So you can see that this handle allows you to have a different type of position than this handle. So there are definitely tools out there that might help you take some pressure off of your body. Do some research on that. So the use of braces and supports, when to use them. For your back, you want to consider your spine, whether you're healing from an injury or if you're just using it for certain activities. So if you are healing from an injury, you might need a different kind of brace. You might actually need a really firm brace to use. If you're just trying to be preventative, you might use kind of one of those, a little bit of a softer brace where you're just giving yourself a little bit of support. The Velcro wrap braces can be nice. The knee brace might be used primarily with squatting movement, and those have some stabilizers on the side, or they have just compression if you tend to have some swelling. The wrist brace is primarily used when you're healing from an injury or you're in current pain, not really as a preventative thing, but it just helps to stabilize the wrist a little bit so you're not getting all that wrist motion. Compression, again, is for swelling. It can also be nice for arthritis. And then the stability brace is the presence of pathology going on. Whether or not you use ice or heat depends on what you're using it for. So the ice you want to use for anything acute, and the heat you want to use for muscle soreness. So the ice, if something is actively inflamed, that's when you want to use the ice if it's actively hurting. If you're just sore like the next day from doing something, then you might put some heat on it to calm those muscles down. Just wanted to put in some general exercise guidelines for movement. This is from the American College of Sports Medicine. And the CDC has guidelines too, which is interesting. They focus more from the perspective of diabetes, obesity. And so you can see that they recommend about 150 minutes per week of moderate intensity aerobic activity, which is about 30 minutes, 5 days a week. And then that every adult should perform activities that may increase muscular strength 2 days a week. So strengthening about 2 days a week. And gardening would be considered that if we're going up and down, moving, lifting. It wouldn't necessarily be the aerobic activity. That would be more like walking, biking, swimming. I also, just back to this for a second, I put in your handouts a full guideline of exercises from the exercise guidelines from the American College of Sports Medicine, so that you can kind of review that on your own as well. So I've also put together, and you have access to these in your handouts, some strengthening exercises that you can do to help get those muscles stronger to be able to support your body a little bit better. So these are the strengthening exercises. We'll go through them, but I'm not going to go into a super large amount of detail. You'll have this to reference. And then, like I said, you have the handout printout. They might not all be appropriate for everybody, but they generally are safe exercises for anybody to do. So we have a squat progression, standing leg lift, resistance bands, some weights, and some core. And then we have some balance exercises, and I also have some stretches. So the first one, again, these are to strengthen yourself so you can get a little bit stronger for those good body mechanics during gardening. So the squat progression, this is a way that you can start getting those muscles to work a little bit better through the core, through your hips, glutes, quads, hamstrings, not just your back. You might start with just going a small ways up and down in a chair, holding on. Then you might progress to leaning back into the wall and going down and then back up. Then you might progress to going from sitting to standing. Finally, you might progress to a full squat, and then perhaps adding some resistance going down and up to help really strengthen that coming up motion. Remember, you're breathing out when you stand up. The standing leg lift helps give you a little bit more stability, a little bit more balance. You can stand, you want to keep that pelvis nice and level, and just lift that leg out to the side. If you feel really strong doing this and it's not hard, you can add a resistance band around that. The resisted rows, you want to just stand, putting your band in front of you and just pulling straight back. You're going to pull with both hands. This picture doesn't show it very well, but you are going to use both hands, and you're going to feel your shoulder blades squeeze together. The biceps curls, you might start with just a 2 to 3 pound weights and work your way up. You want to keep your wrist neutral, and it's a good way to kind of train that motion, keeping that wrist neutral while you're moving through a resistance. Bending your elbows while you bring that weight up and down. And then your brace marching is a good way to kind of feel your abdominals pull in a little bit more. You're going to lie on your back, your knees are bent, and then you pull that belly button toward your spine, lift one foot up, and then alternate to the other side. You want to try not to let your back move during that motion. Some stretches. These are the stretches that we'll go through. And there's a pec stretch. It's a really great posture stretch. You're just standing in a corner or a doorway, putting your arms up kind of like a goal post. And then you're just going to bend that front knee. You want to have 1 foot forward, bend that front knee until you start to feel a stretch across your chest. Hold and then repeat that. All of these you want to hold, I think I have it in here in a little bit, about 30 seconds or so, and repeat 2 to 3 times. These are wrist stretches. You're going to keep your arms straight. You can pull your palm straight down towards you to stretch across your forearm and your wrist. You can also flip your palm over so your palm is facing up, and that'll stretch the flexor side of your wrist. You might find that one side is tighter than the other. Hip flexor stretch, you have options for these. And these muscles are really important for posture, but they're also helpful for squatting and getting up and down. So this is a half kneel stretch. You can put a pad under your knee and you're just going to keep everything nice and aligned and just bend that front knee until you feel a stretch in the front of this back leg here. And if that doesn't feel great on your knee, you can put one foot up on a chair and kind of lean forward until you feel that stretch in the front of your leg there as well. Calf stretch. You're going to stand facing the wall. You're going to lean into the wall until that stretch is felt in the back leg and keeping that heel down. Again, your calves really help with posture and with support. And then finally, this piriformis stretch. You're lying your back and cross the ankle over the top of the opposite knee. You can reach with your arms and pull that leg towards your chest, or you might keep this knee or this foot down and just gently press that knee away. You want to feel a stretch right in this glute area here, kind of right up along the side of your leg is your piriformis. And that's a muscle that tends to get really tight and can contribute to back pain. So some of the considerations for exercise, you want to make sure you're breathing. You want to avoid straining. You want to start light and work your way up in intensity. So one of the things that I was thinking about is you can always add force. You can't take it away. So if you're not sure, do I do 2 pounds or 3 pounds? Start with 2. If that feels easy, go to 3 the next time, or increase your repetitions. So maybe you do 10 instead of 8, and then 12 instead of 10, but you keep the same weight, and that's okay too. And keep your core engaged while you're doing your exercise. When you're stretching, you want to hold for 30 to 60 seconds and repeat 2 to 3 times. Or if you go into a stretch and you're like, I don't feel anything in this, then you don't need to continue to hold it. Some other considerations in general: stay hydrated. Remember your core. I want you to hear me in your head like I'm a little bird on your shoulder whenever you're gardening. Natalie said, remember your core. Take breaks as needed. It's okay to ask for help. You don't have to lift the heavy things on your own. If you have pain that does not improve or gets worse, seek medical advice. And then something else to note is in Virginia, physical therapists have direct access to see patients for 60 days, which means if you have an issue or a question, you can come see a PT without having to go get a referral from your doctor. And we can treat you actually for 60 days. It used to be 30. It just changed like this month to 60 without a physician referral, which is nice. We're a little bit more available and can give you some guidance on that. So thank you so much for having me and for listening. I want to thank Lynn Fintra. She arranged this talk for me. And thank you, Kathleen Fitzpatrick, for being my wonderful model. And thank you all for being here. Again, this is my clinic where I'm working, Innovative Therapy and Wellness, our website. And then this is Physical Therapy Anytime. This is a website that my boss and I started last year, and it has subscription-based resources for home physical therapy to help you go through your home exercises and give you education and postural tips for all of the main joints in your body. So you might consider visiting that as well. And I'm ready for questions, Candy.
All right. Well, a couple of things I will note is that, well, first of all, the poll is in progress for folks to fill out. Also, I noted in most of our presentations, people join, they leave, join, leave. Not in yours. People joined, they stayed. So obviously you've hit a nerve with us.
Okay, good.
So here's some of the questions. I have hip pain after gardening. What's the best exercises to help with that?
Yeah, so hip pain, generally speaking, is related to tight muscles, especially after an activity. So you want to do stretches, that piriformis stretch where you have your figure 4 ankle crossed over the opposite knee. will help alleviate that pain right after. And then to help prevent the pain from coming back, you want to do your hip flexor stretch, which is the half kneeling one. But then it's important to strengthen and then figure out, okay, am I, again, using my right mechanics so that I don't put undue stress on different parts of my body?
Okay, next question. I'm 5'1". Most tool handles are taller than me. Any advice for shorties?
Those tool handles. I'm assuming you're not talking about like hand tools. So something that you would be, can you give me an example of a handle that like you would be reaching up to use the handle?
I actually will have to
Yeah,
ask the
there.
person
Yeah,
who,
so if you're holding something up here, then you might need to actually adjust. And if you can hold it down and maybe you are a little bit further away from it so that you're in a better position, because you don't want to be up here. If your arm is extended overhead for any prolonged period of time, again, coming back to those mechanics, you want to make sure that your shoulder blade is staying down and you're not coming up here. So keeping that shoulder blade kind of in your back pocket is what I think about. And that way, if you do have to be up here for any length of time, you're at least using your good mechanics. And then taking note that overhead activities require more core strength. So if you are a little bit shorter and doing a lot of overhead work, you might need to really work on strengthening your core, like with those brace marching exercises.
the person clarified, said, yes, like a shovel, the handle is really high.
Okay. Yeah. So with a shovel, if I had mentioned kind of pushing down, but you might actually bend your knees and get lower. So you're pulling down this way and you're still keeping your forearm in long, like along the length of the shovel. So you're keeping that forearm this way and pulling down. And that means getting lower and bending your knees and sitting into it. And that might help.
What is half kneeling?
Half kneeling is when one knee is down and the other foot is out in front of you, is up in front of you. So just one knee is down.
One participant wrote, I'm 75 and have trouble getting up from a kneeling position, and I can't squat. How can I best weed?
So there are a couple of things. Instead of kneeling, you can use a stool. That's where I would suggest using something to sit on. And if you are using a stool, the consideration that you want to think about is bringing your knees really wide. So you're sitting on the stool and your knees are pretty wide so that you have a lot of room to lean forward in front of you. And just like with standing, that wider base of support takes stress off of your spine. If your knees are really close and you're trying to bend forward in front of you, you're going to have more stress in your back.
I got actually two questions about riding lawn mowers. One has to do with how do you prevent back pain while on a riding lawn mower? And the second one had to do with how do you practice good posture while on a riding lawn mower?
Yeah, so there's a couple of things with the riding lawnmower. Again, with the back pain, it's going to be about your core support. Okay. And with the posture too. So you want to really be feeling your abdominal muscles pulling in, like someone's going to punch you in the stomach, holding on to that. And then you might consider kind of how everything else is positioned. If you can adjust the steering wheel, making sure that that's at a comfortable height for you so that you're not leaning forward into it, adjusting that some, seeing kind of where your foot position is, if your legs are extended out in front of you versus kind of right underneath of you. The further out in front of you you're going to be more likely to tilt back and sit into that kind of slump sitting posture, where if you can keep them kind of right under you, you'll be more likely to sit up. If you find yourself like really kind of sinking down while you're riding, you might even strap on. There are lumbar rolls. It's a lumbar support pillow and it has a strap around it and it's meant to put over the back of a chair, but you can actually strap that onto the back of your lawnmower seat and it'll just be like a little pillow and it'll give you a little bit of that support while you're riding.
Okay, I'm going to butcher this one, I'm sure. The de Quervain tendon. Do you know what I mean?
Yep.
Okay, great. Does it cause stiffness and pain in the thumb where it meets the rest of the hand?
It can cause stiffness. It definitely causes pain. So if you have stiffness that is not increasing, generally with the de Quervains, it increases with use versus an arthritis, because this joint is also very common to have arthritis in. And with an arthritis, it's generally more achy in the morning. It might be the same, whether or not it might actually arthritis increases through, or I'm sorry, with arthritis, as you do more, the pain sometimes goes away versus first thing in the morning, it is really stiff. So that's kind of a way to tell the difference. Whereas with the de Quervains, with the tendonitis or tenosynovitis, the more you do, the more aggravated it gets and it stays inflamed and irritated. So that's kind of the difference between those two. If you have de Quervains, you want to ice it. Arthritis might like heat.
Well, that brings us to the next question. Tennis elbow, heat or ice?
Ice, ice, ice. Inflammation of the tendons, any inflammatory process, you want to ice, especially if it's a soft tissue inflammation, you want to ice it. An arthritis condition generally likes heat a little bit better. And then again, the muscle soreness likes heat, but tennis elbow, you want to ice. And one of the nice ways to ice is actually an ice massage, where you take a Dixie cup, put water in it, and then freeze that. And then you have a nice little cup to roll a nice little ice massage over that area. Or you can just use an ice cube directly on that area. And then you only have to do it for 3 to 5 minutes instead of 10 to 12 minutes.
Fantastic. One of the questions we got is, are there any cures for old age?
I wish I had more things to answer that with. I think staying active, staying healthy, do your exercise, eat well, stay hydrated. That resource, that handout that I've given you from the ACSM actually has some really great tips for staying active and staying healthy as you age. So read through that and see what you think about it.
All right, and we have a question from somebody who is in Washington, D.C. In that area, do people have direct access to physical therapists without the doctor's referral? And you may not know that, I realize.
That's a good question. I want to say yes, but I do not know. I know that you could do it with a quick Google search. You would just look for a direct access by state, but most states, and by most, I mean like 75% of them have direct access, even if it's limited direct access. And what that means is that they might only be able to see you for 14 days or something, but you could at least get in there and see what's going on.
We had a number of questions about where to see the video and how to get the handouts. And I'll just tell people that you can, the place where you joined this presentation, which is vbmg.org. The presentation will be posted, and the handouts are there also for anybody who wants to bring them up or print them out. I did get one question about getting copies of your slides. And I don't know how you feel about that.
Oh, as a handout? I
assume so.
Yeah, I can send that. I'll send it to Stacy, and then
that'd be great.
Figure that out.
Yeah, she can put it on
Stacy.
She can put it on the website. Well, thank you very much, Dr. Foray, for your excellent presentation. You got a lot of accolades in the chat box. And I want to thank everybody for joining us. If you enjoyed this presentation, please tell a friend to join us on October 18th for a discussion with Sherry Curran on sex and the single flower. The presentation will be posted, as I noted, on bbmg.org within 7 days. If you have friends or family you think would enjoy this, please let them know where they can find the presentation to see. And all of our other garden talks are in the same place. Lastly, it will help us a great deal if you would complete that brief survey. And the link to the survey has shown up already. So thank you very, very much. We appreciate your time. And thank you, Linda, for setting this up.
Thank you
Thanks,
all very much.
Thank you.